Transitions care is an important part of our everyday life. We know that many of our patients leave the hospital, go to their community, and sometimes have challenges and issues. Hello, I'm Paul Takahashi. I'm one of the authors for Hospital to Community Transitions for Older Adults, an update for the practicing clinician. This was an article that has been published in the Mayo Clinic Proceedings. This article outlines some of the recent findings that many of our colleagues here at Mayo Clinic, as well as other places, have performed over the last few years to evaluate this part of our practice. We basically describe some of the models that are currently used for care transitions. Some of those models include having in-home visits by nurse practitioners or physician's assistants to facilitate the home care after being dismissed from the hospital. Oftentimes, these patients will receive intense care. They'll receive care for their acute issues, some of their chronic disease management. They'll talk about community resources, go over their medications, and then provide follow-up and making sure they have a phone number to work with. That is a model that has been widely used and was initially championed by Mary Naylor in the University of Pennsylvania. A second model is the Coleman model, which uses health coaches to help facilitate care for the patients themselves and to empower patients to provide the care that they need after being dismissed from the hospital. We recognize these are important models, and Mayo Clinic has utilized a combination of both to help our patients as they leave the hospital. Our article describes some of our findings from our care transitions program. We oftentimes see these patients who are the highest risk, the people who have multiple illnesses or older, and when they are identified in the hospital electronically, we offer them care transitions once they leave. Those care transitions programs can include having a home visit by an advanced practice provider, such as a nurse practitioner or a physician's assistant. That's usually done within 5 days. They have a full medication reconciliation. They go over their medications. They provide care for their acute issues, look at their chronic diseases, discuss advanced care planning, and discuss their goals for the future, and help to facilitate this over the 2 months following hospitalization. We found that patients who were getting that type of care had a reduction in their hospitalization use at 30 days to about 12.1%. And the people who were not getting that type of care in comparison had rates up to 20% readmission. Thus, we had a reduction in 30-day readmission, which was quite encouraging. We also discussed that patients will like this model. They're very happy with it. We've done qualitative research to show that people are very excited about getting that type of care. They like being at home. They like being on their home turf. They like talking about things when they're home because you're more of a family type of situation. They also talked about it's been cost effective and are the very highest utilizers to have this type of care. So that's been encouraging. So these models are very, very important. So in summary, care transitions programs are an important part of our lives for all of our patients coming out of the hospital, as well as for us in primary care and long-term care receiving these patients. We will continue to strive to provide timely care, and certainly encourage you reading the full manuscript to get further tips and tricks and pearls. Thanks again.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.